Today on In Your Face Anatomy, we are looking at the joints part 2. Alright, enough of this crap. Let's get into it. Alright, joints part 2. We're going to do a quick little segue into muscles for a moment here. So, movement at a joint occurs when a muscle contracts and its fibers pull its movable end as its insertion towards its fixed end, known as its origin. So muscles have two ends, one that moves towards the other end. So the movable end is the insertion, the fixed end of the muscle is its origin. Let's know the difference between the two. Then we're going to talk about range of motion. So range of motion, super important for doing physical examinations, taking histories, whatever. So let's know our range of motion. So first we've got flexion. Flexion is where parts of the joint come closer together. So you can do like finger flexion, arm flexion, head flexion. If you like tuck your chin down towards your chest, that's head flexion. You can see in the picture to the far right where we've got the leg going into flexion when the knee bends, pulling it closer or extending it out. So extension is the opposite. So flexion, we bring the parts closer together. Extension, we move the parts further apart. So we can see in the middle picture, we've got flexion of the wrist where we're bringing it closer together. But if we push it back out, then that is extension. Hyperextension is where we move beyond anatomical position. We move the joint farther than we are supposed to move it, essentially, and that's hyperextension. Lateral bending is primarily with the neck. That's what we're going to be talking about. That's just where we use it the most. You may also see this as lateral flexion. Lateral bending, lateral flexion, same thing. And that's where we get the patient to touch their ear to the shoulder. You just got to watch the patient, make sure they don't bring the shoulder up to touch their ear because that's cheating, doesn't count. And then we compare both sides. Dorsiflexion and plantar flexion, we're talking about the foot. So we can see in the middle picture on the bottom, plantar flexion is where we point our toe out. We point our toe down. I always remember this with plantar flexion is I'm planting my toes, just my toes. I'm planting my toes into the ground. That's plantar flexion. And you use this if you get people to walk on their tippy toes. Dorsiflexion is the opposite. That's where we bring our toes closer to our shin. And you see this when people walk on their heels. And both walking on your toes and walking on your heels are indicative of different types of low back pain. So super common, something you will absolutely use. So let's know the difference between dorsiflexion and plantar flexion. Now, abduction and adduction, they get a little tricky because they sound so similar. So in the real world, we don't really say abduction. We say abduction, and adduction. Abduction and adduction. And that's where we just move things out to the side. So you can abduct your finger, you can abduct your arm, you can abduct your leg and lift it out to the side of your body. That's abduction. And when we bring it back in, that's adduction. And we can see that in our picture below here on the left where they're abducting the leg out away from their body and then adducting the leg back in towards their body. Rotation is just defined as moving a part around an axis. When you have two types, medial rotation, also known as internal rotation, and that's where we move towards a midline, towards that midline of our body. Lateral rotation or external rotation, we're moving away from the midline. And then circumduction is where we just move in a circle. We can see a good picture here where the guy is just moving his arm in a circle. That is circumduction. Now, supination and pronation. Supination is a palm up. We're flipping our hand palm up. Pronation, we're turning our hand palm down. You may also see this as supine, where the patient is face up, or prone if the patient is face down. Same concept. Pronation, palm down. Supination, palm up. Eversion and inversion, we're back to the foot. So inversion, remember we said we stepped in it, and the way you're going to turn to look at the bottom of your shoe to see if there's anything on there, that is inversion. Eversion is where we're turning our foot out laterally away from our body. So inversion, we stepped in it, we're looking at the bottom of our shoe. Eversion, We're turning our foot outward the other way. Protraction, just moving a part forward. We can see in that middle picture how she's pushed her head forward. That's protraction. Retraction is where we pull the head back. Elevation, we're raising a part of our body. And depression, we are lowering a part of the body. Now, for the written test, I could say something along the lines of, what's the range of motion where we turn our foot medially? And you got to be able to tell me that's inversion. Or on the practical exam, I could show you a picture of someone turning their foot medially, and you would have to list that as inversion by the picture for the practical exam. So both of the tests, the practical exam and the written test, you will see some range of motion questions on there. More so on the practical than on the written, but you will find them on both. Good luck.